Right now, there are 5 bills that Canadian seniors are paying every single month that the law does not actually require them to pay. Not reduced bills, not discounted bills, bills you are legally entitled to stop paying, reduce to nearly zero, or have completely waived. And almost nobody tells you this. Nobody calls you. Nobody sends a letter explaining it in plain English. You simply keep paying, year after year, money that the system never expected you to hand over in the first place. I have gone through the actual government and provincial rules, not rumors, not guesses, not vague advice from a forum somewhere, to find exactly which 5 bills this applies to, and exactly how to stop paying each one, province by province, program by program. By the end of this video, you will know all 5, you will know if you qualify, and you will know the exact words to use to claim what is already legally yours. This is not about loopholes, and it is not about anything questionable. These are programs that exist specifically for people in your situation, written directly into provincial and federal law, sitting there waiting for someone to actually ask for them. If you are 65 or older, or you are caring for someone who is, stay with me, because this could put real money back in your pocket starting today. Before we get into the 5 bills, if you are not subscribed yet, please do it now. This channel exists to find exactly this kind of information, the exemptions, the programs, the rules buried in government documents that most seniors never hear about, and bring it to you in plain language. Hit subscribe, turn on the bell. It takes 3 seconds and could save you hundreds or even thousands of dollars a year. Bill number 1 is the biggest one most homeowning seniors are paying without realizing they do not have to. Your full property tax bill, paid all at once, every single year. Almost every province and many municipalities across Canada offer a property tax deferral program specifically for senior homeowners. In British Columbia, eligible seniors aged 55 and older can defer their property taxes entirely at a very low interest rate for as long as they continue to own and live in their home. In Alberta, the program works similarly through a low-interest home equity loan that the government pays directly to your municipality on your behalf, and the current interest rate is reviewed and adjusted only twice a year, which keeps it predictable. Ontario, Saskatchewan, New Brunswick, and the City of Ottawa all run their own versions of this same idea. You do not pay your property tax now, the government covers it, and it is settled later, often when the home is eventually sold. For one senior in a smaller community, this can mean the difference between $200 or $300 a month staying in their pocket instead of leaving it. This is not free money, and I want to be completely honest about that. It is a deferral, not a forgiveness. Interest accrues, and the balance is eventually repaid, usually from the sale of the home. But for seniors on a fixed income who are asset-rich in their home but cash-poor every month, this single program can be the thing that keeps them living independently instead of being forced to sell, rather than feeling pressured to downsize simply because of a single annual bill. Eligibility usually requires that the home be your principal residence, that you carry adequate insurance, and that you maintain a minimum level of equity, so the exact rules are worth confirming directly with your province. To find out if your province or municipality offers this, search the name of your province plus the words Seniors Property Tax Deferral, or simply call your municipal tax office and ask directly. Bill number 2 affects almost every senior reading a prescription label. The annual deductible you pay before your provincial drug plan starts covering your medication. In Ontario, for example, every senior is automatically enrolled in the Ontario Drug Benefit Program the month after they turn 65, but most still pay the first $100 of prescription costs out of pocket every single year before coverage applies, followed by a co-payment of up to about $6 for every prescription filled afterward. What most seniors never apply for is the Seniors Co-Payment Program, which waives that $100 deductible completely and drops your per prescription cost down to just $2. To qualify in Ontario, a single senior needs an annual net income of $25,000 or less, and a senior couple needs a combined income of around $41,500 or less. Here is the part that surprises people. This program is not automatic. Unlike basic drug coverage, you have to actually apply for it, and that application can be done once, with your consent for the government to verify your income electronically every year afterward, so you do not need to reapply constantly. Thousands of qualifying seniors across Ontario alone are paying that full $100 deductible every single year simply because they never knew this second, more generous program existed, even though they would easily qualify based on their income. Every province has some version of this enhanced low-income senior drug benefit, sometimes under a completely different name. The income thresholds and exact savings differ, but the principle is the same everywhere. Lower-income seniors are entitled to far less than the standard deductible and co-payment. Call your provincial drug benefit program directly or ask your pharmacist. Many pharmacists know exactly which low-income senior program applies in your province and can point you toward the application. Bill number 3 is one almost no senior thinks to question because most Canadians assume everything they buy includes sales tax automatically. But a wide range of health-related purchases and services that seniors rely on are completely exempt from GST and HST by law under the Excise Tax Act. Wheelchairs, walkers, hospital beds for home use, hearing aids, and many medical and assistive devices are zero-rated, meaning you should never be charged sales tax on them at all. Most prescription drugs themselves are also zero-rated, along with the pharmacist's dispensing fee for filling that prescription. Most home care services, bathing assistance, meal preparation, light housekeeping, medication reminders, provided to a senior in their own home are also exempt from GST and HST when they meet certain government funding conditions, such as being paid for through a government or municipal home care program rather than entirely out of pocket. Most medical, dental, and health services provided by licensed physicians, dentists, and similar regulated health professionals are also fully exempt from sales tax, and this extends to a wide range of practitioners, including optometrists, chiropractors, physiotherapists, and audiologists. The mistake many seniors and their families make is simply paying whatever is on the invoice without checking whether tax should have been charged at all, especially when ordering medical equipment online or through a private supplier rather than a hospital. If you see GST or HST charged on a wheelchair, a hospital bed, a hearing aid, or a home care invoice, ask the supplier directly why tax was applied, because in many cases it should not have been, and you may be entitled to a correction or a refund of the tax already paid. Bill number 4 is a small one individually, but it adds up fast for seniors managing ongoing appointments: hospital parking fees. Under federal tax rules, parking at a public hospital is generally exempt from GST and HST when it is provided by a charity, a nonprofit, a hospital, or another public sector body. But beyond the tax exemption itself, many hospitals and regional health authorities across Canada offer dedicated free or significantly reduced parking programs specifically for seniors attending frequent appointments, dialysis, chemotherapy, or other ongoing treatment. These programs are almost never advertised on a poster in the lobby. You typically have to ask the hospital's patient services or social work department directly. For a senior attending 3 appointments a week for an ongoing condition, parking fees alone can quietly cost more than $50 a month, money that a simple phone call to the hospital could eliminate entirely. Call the hospital directly and ask specifically, does this hospital offer a reduced or free parking program for seniors with frequent appointments? Bill number 5 is the biggest one of all, and it is sitting quietly inside your federal income tax return every single year, whether you realize it or not. If you are 65 years of age or older by the end of the tax year, you are entitled to claim what is called the age amount, a non-refundable federal tax credit worth over $9,000. This credit directly reduces the amount of federal income tax you owe, and it requires nothing more than checking a box and reporting your age correctly on your return. It does reduce gradually if your net income is higher, and it disappears entirely above a certain income level, currently around $45,000 of net income. But for the vast majority of GIS recipients and modest income CPP recipients, the full credit applies without any reduction at all. Here is the part that should genuinely concern you. If you qualify for this credit but you do not need the full amount yourself, perhaps your income is very low and you owe little or no federal tax, you can transfer the unused portion to your spouse or common law partner, which can meaningfully reduce what your spouse owes instead. Many couples never realize this transfer option exists, and one partner simply lets thousands of dollars in available credit go completely unused every single year, money that could have legally reduced their household's combined tax bill. This is exactly the kind of thing the free tax clinics we have talked about on this channel before are specifically trained to catch, but only if you ask, or only if you are filing with someone who knows to look for it. When you file your taxes this year, or when you sit down with a volunteer at a free tax clinic, say this clearly. Please make sure I am claiming the full age amount credit and transfer any unused portion to my spouse if applicable. Let me bring all 5 of these together into one simple action plan, so you know exactly what to do this week. For your property tax, call your municipal tax office this week and ask specifically, does our province or municipality offer a senior property tax deferral program, and am I eligible? For your drug deductible, call your provincial drug benefit program or ask your pharmacist directly, am I eligible for the low-income senior co-payment program that waives my deductible? For your GST and HST, before paying any invoice for a medical device, home care service, or hospital-related cost, ask the supplier directly whether that charge should have included sales tax at all, and keep your receipts in case you need to request a correction. For hospital parking, call the hospital's patient services department directly and ask whether they offer a reduced or free parking program for seniors with frequent appointments. And for your federal age amount credit, when you file this year, confirm out loud in those exact words that you are claiming the full credit and transferring any unused portion to your spouse. None of these 5 steps require a lawyer. None of them require fighting with anyone or filling out complicated appeals. Every single one of them is simply asking the right question to the right office, using the right words, and most of these calls take less than 10 minutes from start to finish. I want to end with this. None of these 5 programs exist because the government wants to make your life complicated. They exist because lawmakers specifically decided that seniors on fixed incomes deserve this relief. The complication is not in the law itself. The complication is that almost nobody tells you these programs exist, and most seniors simply keep paying full price out of habit, not because they have to. If even 2 or 3 of these 5 bills apply to you, this video alone could be worth hundreds, possibly thousands of dollars to your household this year. Please take 15 minutes this week and make at least one of those 5 phone calls. Pick the one that feels most relevant to you right now and start there. And if you know another senior, a parent, a neighbor, a friend who might be paying one of these 5 bills without realizing they do not have to, send them this video directly. If this video helped you save money today, please subscribe. I am continuing to dig through government programs, exemptions, and rules that affect Canadian seniors, and I will keep bringing you exactly what I find. Thank you for staying with me through all 5. I will see you in the next one.